Good. Okay. So let's just talk about what types of heart issues can COVID kind of cause or exacerbate?
So that's a great question. Unfortunately, both non-invasive, meaning imaging studies, and invasive, meaning studies that they've actually done on patients who've died from the COVID infection, have shown to have evidence of increased inflammation in patients' hearts. So we know that there's some level of what we call myocarditis and inflammation in the heart associated with COVID infections.
Does this happen to every patient? I mean, obviously we don't have a way to know everybody, but is it like a certain age group, or can it really, age is not a discriminator here?
That's the unfortunate reality, is age is not a discriminator here. It is true that patients who have pre-existing conditions are at increased risk for doing worse with a COVID infection. But the study in Germany that did MRIs on patients who were exposed to COVID, a lot of them did not have pre-existing conditions, and they were found to have markers or evidence of cardiac inflammation. So that's very concerning.
What types of issues, so obviously heart issues could cause a patient to, have this disease or virus worse and pass away. But what types of heart issues are we seeing in patients who recover from the virus, but maybe 2-3 months later are seeing issues?
So anecdotally, we're seeing patients who've been exposed to COVID, and this is at any age, who are noticing increasing amounts of palpitation. Okay.
Let's let the elevator speak. Okay, let's start over.
Yeah.
So we'll ask the question.
Yeah, please.
For patients who recover from the virus, 2-3 months later, what types of things are we seeing in terms of cardiac problems or worsening of their original cardiac issues?
So we're seeing an increased incidence in worsening symptoms. So some patients, some who've been previously healthy without cardiac issues, have been complaining more of palpitations or shortness of breath, things of that nature. Now, we still have to tease that out about what exactly is leading to their symptoms. Is it actually new arrhythmias? Is it the cardiac inflammation that we're seeing? The problem that we're seeing still is this is a relatively new virus, and we don't have a great handle on what the long-term ramifications are, since we've been just dealing with this virus for less than a year.
Sure. What do you tell your patients who are, coming in for their regular checkups with you, et cetera, who are kind of living in this new world, but know that they have cardiac issues?
I still think I would maintain, especially for the patients that I see, because they're by and large an increased risk for the side effects of a COVID infection. They're going to potentially do worse than your average patient. So social distancing, maintaining that 6 feet separation between people is huge. Wearing a mask like I'm wearing now during this interview is huge, not wearing it like this. Also, keeping good hand hygiene is very important. So those 3 things are the best things one can do to minimize the risk.
And then what would you tell people who think they could be experiencing symptoms of some sort, who are either, hesitant or anxious to, number 1, go to a doctor's office, number 2, go to the hospital should they think they were having a heart attack or something?
If you're having a heart attack, you still should be doing the normal things under non-COVID times, and that is calling 911 and having EMS come pick you up to the hospital and evaluate you. We have streamlined protocols for patients with chest pain to not only protect patients but protect ourselves from exposure. So unfortunately, at the very beginning of the COVID experience, we've seen a lot of patients delay their care because they thought the risk versus benefit was to stay at home. Unfortunately, what we've seen is more patients who should have come in and now have had long-term effects from their heart attacks that may likely would not have happened had they come and gotten prompt care.
So is it safe to say that the risk of doing nothing about your heart attack leads to more, doing nothing about your heart attack likely will lead to more serious conditions than the COVID virus would?
Correct. If you're having signs or symptoms of a heart attack, if you're at all concerned, call 911. Don't delay, because the risk of doing nothing is worse than the risk of a COVID infection going to the ER.
Great. Any questions? Anything I missed?
No, you were great.
Do you want